Is ice or heat better for a bulging disc? If you've been diagnosed with a disc bulge, like an L4-L5 disc bulge or an L5-S1 disc bulge, and you have either back pain or gluteal buttock pain or thigh pain or pain in the calf, ankle, numbness or tingling, sciatic leg pain, and you're wondering, is ice better for a bulging disc or is heat better for a bulging disc? This question answered in this video. Hi there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to stabilize and strengthen your back, and also introduce you to structural corrective chiropractic care. Like this, you can bend, move, and lift normally without pain and limitation. If you want to learn about these tips and strategies on a weekly basis, do subscribe right now by clicking on that subscribe button below, tap on the notification bell, turn on the YouTube notification on your mobile devices. Like this, you don't miss out on my weekly video updates. So when do you use ice and when do you use heat if you're suffering from pain and symptoms from a bulging disc? We know that bulging discs can cause a tremendous amount of back pain, buttock pain, leg pain, calf pain. But if you're looking for a way to relieve some of the pain in the lower back region that's from a bulging disc injury, ice and heat may be an option. But when do you use either one? Well, let me tell you the reason to use ice, let me tell you the reason to use heat, and then I'll tell you when to use ice and when to use heat, because you can actually use both of them, but at different times. So ice generally is good for numbing down the pain, for calming down the inflammatory process. Inflammation produces swelling in the local area. It produces an increase in blood flow. Because of that, there is increased heat and warmth in the area, and also there's pain associated with that as well. So those are typical signs of inflammation. So ice, because of its cooling effect, will decrease the dilation of those arteries and blood vessels in that area. So that'll decrease the actual flow of blood to that area, and because of that, it will decrease the amount of inflammatory chemicals and mediators that are flushed in the area, and because that can actually numb down the pain a bit. So there is a usefulness for using ice. Heat, on the other side, is used more now to warm up the area, to soothe the tight, achy muscles, to relax those muscles, to give kind of a sedating effect in that lower back injured region. It actually expands blood vessels, dilates blood vessels, so more nutrients, oxygens can actually move into the area. So they should be used differently. Now, for a bulging disc, if it's a brand new injury, a new onset of disc pain, or it's a flare-up of an old disc injury, it's something new, you want to leave it alone. Do not apply ice and do not apply heat. Inflammation, even though it's uncomfortable and it causes pain and limitation in function, actually has a purpose. It starts off the healing process. It's there to fight off invading organisms. If there was broken skin, for instance, like bacteria and viruses, so inflammation is important. If there's not broken skin, like in a disc bulge injury, it brings inflammatory chemicals and cleans out any injured tissues. So inflammation actually has a purpose. So for the first 3 days, as painful as it is, you want to let the natural inflammatory process to proceed, so you do not apply ice. I repeat, do not apply ice. Now, after 3 days, once the inflammatory process settles in, you don't want that inflammatory process to continue into a chronic inflammation. So chronic inflammation will develop into scar tissue, fibrosis. So you want to reduce the inflammation after the 3 days. As well, by applying ice after 3 days of an acute injury or an immediate injury, then that will actually begin to help subside the pain, numb down the local pain because of that disc bulge injury. Now heat, I'll tell my patients to use heat well down the line. So I don't tell patients to use heat in the first 3 days. I don't tell my patients to use heat after the first 3 days. Down the line, when the recovery has now set in, there's a lot less acute inflammatory related pain in the lower back, then the muscles are guarding and are tightening up and are becoming stiff or in spasm, then an application of heat is useful at that point to actually calm and relax those muscles, and it just feels comfortable and soothing. Okay, now, so what amount of time do you use it? So when it's time to use ice, you can use it for about 10 to 15 minutes and repeat it every hour a couple times during the day. Same thing with heat. When it's time to use heat, you can use it for 10 to 15 minutes and then repeat it as well several times throughout the day. Okay, so hope you found this useful, and there are different times to use ice, there are different times to use heat, and in the first 3 days, just leave it alone. And if you want to learn more about disc bulge injuries, the anatomy of disc bulge, why it causes so much pain, and 4 great exercises to help alleviate some of that pain, then go look at this video right now to continue your learning.